Hello, I am Dr. Larry Kotlow, and I'm going to give you some instructions here today on how to use 4 instruments which I've worked with Armor Dental to make laser surgery and patient comfort of our primary importance. The materials are non-toxic, they're non-latex, they're firm so we can get good surgical results, and for our lasers they're important because they're non-reflective. It is a significant improvement over what is available for us out there, especially the Groove Director, which is metal, as well as a few other attempts to provide our patients with a easier and safer home care. And I think you'll find our units are maximizing what we do in helping our patients. I'll show you 4 different dental instruments which Armor Dental has worked on with me to enable you to improve the quality of dentistry you're doing and make it more comfortable for the patient. So one of the first instruments is this instrument here. It's called ComfortSoft. What I like about ComfortSoft is you can place it in the cheek and pull the cheek out. You can do this to protect the tongue if you're using your laser or your high speed and you're not using any kind of isolation. You can put it next to the tongue to protect it. You can pull out the cheek to protect it. And it works both ways. It also is bendable, so if you prefer to use it like that, it works, and then you can come over onto this side. It's also helpful for patients who have handicaps for toothbrushing, where their caregiver has to get into the mouth, because when you place it all the way back here, it seems to help the patient open their mouth and not bite down to enable you to get your fingers in without the patient biting you. So this is called ComfortSoft. The next instruments are 2, and these are the tongue guides. There's one here we use in the infant and toddler stage, and another one when the kids are a little bit older and the frenum is a little bit thicker. They're interchangeable. If you have a thick infant or you have a thin toddler or older patient, you can either use one or the other. What I like about these instruments is this curved handle here. It enables you to take your instrument and get under the tongue here. So this is our tongue, and basically the curvature keeps it away from the face. If you're familiar with the old metal instrument, the Groove Director, if you put it on the face and the groove was there, the patient would get a line across. So here it's very comfortable. This one does not bend because we want it kind of stiff. So again, when you're going to do surgery, you get it under the tongue in the frenum and you just pull it up. I like to use it. My assistant helps me, but we work in this position, more or less the 1 o'clock or 12 o'clock position. Now I'm left-handed during this, so obviously you would reverse it if you're right-handed. The third instrument is very similar, but the groove is a little less deep, and this is our home unit. And I find parents prefer this because they're able to get in under the tongue without having to get their hands in the mouth, and they can elevate the tongue 1, 2, 3, 1, 2, 3, 1, 2, 3. The directions on how to use it are printed out on my website, kidsteeth, KIDDSTEETH.com, and there's a video on showing how to use it, but it's very comfortable for the patient. And again, I like to have this curvature out because it doesn't put any pressure on the gums or the teeth for the patient. So that's a brief tutorial on how to use these instruments. If you have questions.